My name is Muhammad Sabar bin Serti. I'm from Faculty Sports Science and Coaching in Sultan Idris Education University. I'm going to talk about epidemiology of sport injuries. My topic is groin strain. The groin strain commonly happen at thigh of your leg. First, the groin strain can be defined an injury or tear to any of the adductor muscles of the thigh. These are the muscles on the inner side of the thigh. Sudden movements usually trigger an acute groin strain, such as kicking, twisting to change direction while running or jumping. Athletes are most at risk for this injury. Groin muscle strains are encountered more frequently in ice hockey and soccer than other sports. These sports require a strong eccentric contraction of the adductor musculature during competition and practice. And then, the underlying injury is most often a muscle or tendon strain at the insertion of the tendon of the adductor muscle to the bone. The adductor longus is most commonly injured. Okay, and then I want to talk about the groin strain in posture. First, femoroacetabular impingement (FAI), pinching between the femur thigh bone and the acetabulum hip socket caused by bony overgrowth to the femoral hip neck offset (CAM) type or acetabular hood pincher type. Okay, the second one is hip flexor strain. The iliopsoas is known as the strongest hip flexor muscle within the hip flexor muscular complex. Iliopsoas does more than just flex the hip toe. The iliopsoas is also heavily involved in lumbar posture and pelvic control. Strains in this region can also be a cause of groin pain. The third one is athletic pubalgia, pain in the lower abdominal wall, with pain oftentimes radiating into the groin region. The most widely accepted theory of athletic pubalgia pathogenesis is a disrupted rectus tendon attachment to the pubis and a weakened posterior inguinal wall. And then I want to talk about hip adductor and flexor strains prevalence by sport. During the 2009 until 2010 through 2014 until 2015 academic years, the prevalence of hip adductor and hip flexor strain were investigated in 12 NCAA men's sports. One athlete exposure was defined as one student athlete participating in one practice or competition in which he was exposed to the possibility of athletic injury, regardless of the time associated with that participation. Okay, as we can see in the chart, the soccer is highest of hip adductor and hip flexor strains per 10,000. Okay, and then percentage of injuries that are recurrent. As we can see, the highest of hip adductor strain from women tennis 38.3%, and then the highest hip flexor strength from women's ice hockey 30.6%. And then I'm gonna talk about epidemiology of hip flexor and hip adductor strengths in National Collegiate Athletic Association athletes. First, the mainstream sports with the highest rates of both 1. Hip adductor strength and 2. Hip flexor strength were men's soccer and men's ice hockey. The second one, recurrence rates of hip strengths were remarkably high in ice hockey, which calls for increased focus on the sufficient rehabilitation and stricter criteria for return to sport among the athletes. And then, symptoms of groin strain. Grade 1 groin strain, mild discomfort, often no disability, usually does not limit activity. And then, grade 2 groin strain, moderate discomfort, limited ability to perform activities, moderate swelling and bruising. Grade 3 groin strain, pain with walking, muscle spasm and swelling, significant bruising. Okay, the other symptom is pain, usually felt in the inner thigh but located anywhere from the hip to the knee. The second one, decreased strength in the upper leg. The third one, swelling and then bruising, difficult walking or running without pain, and lastly, snapping sound at the moment of injury. The treatment. First, ice the inside of your thigh to reduce pain and swelling. Experts recommend doing it for 20 to 30 minutes every 3 to 4 hours for 2 until 3 days or until the pain is gone. The second one, compress your thigh using an elastic bandage or tape. The third one, take anti-inflammatory painkillers. Non-steroidal anti-inflammatory drugs like ibuprofen and naproxen will help with pain and swelling, but studies show their effects are controversial, especially if taken long term. Additionally, this drug can have side effects. They should be used only occasionally unless your doctor specifically says otherwise. Okay, and lastly, groin strain exercise. First, hip adductor stretch. The second one, hamstring stretch on wall. The third one, side lying leg lift crossover, and then straight the raise and hip flexor, hip extension, hip adduction, and lastly hip adduction. Thank you for the watching.